All right, so now we are going to talk about hearing impairments. So hearing impairment, it's where a person with a hearing impairment is not able to hear as well as somebody who has normal, quote unquote, normal hearing. So this means that a person with a hearing threshold of 20 decibels or better in one or both ears is considered to have a hearing loss. So that is that tipping point between having hearing loss and not having hearing loss. It may be mild, moderate, severe, or profound, and I'll show you kind of what that looks like. It can affect one ear or it can affect both ears, and it usually can lead to difficulties in hearing conversations, speech, or sounds. So understanding things like if you're working with a client who has a hearing impairment or hearing loss on one ear, that you want to make sure that when you're talking to them, you talk to them on the other side. So if they have hearing loss in the left ear, it would be better for you to talk to them on their right side than on their left side. Just kind of keeping those things in mind when working with individuals with hearing loss. When we talk about decibels, so like I said, 20 decibels or higher would indicate that somebody has hearing loss. So humans can detect sounds of 0 to 140 decibels. The eardrum would rupture at about 150 decibels. So 1 pound of, explosives is 180 decibels at 15 feet. So just kind of showing you what that looks like from 0 all the way to 140. So that would be like a firework. And that's at our threshold of pain. So pretty interesting. Looking at the anatomy of the ear, so the part that we can see, that is our external ear, and then that travels in, we have our middle ear, and then we have our internal ear. So all three kind of work together. Within our ear, we have the cochlea, so I'll show you what that looks like. It almost kind of looks like a snail. So with the cochlea, this is a hollow spiral-shaped bone that is found in the inner ear, and it plays a key role in the sense of hearing and participates in the process of auditory transduction. So kind of our ability to hear and understand what somebody is saying. It allows specific areas along the spiral to be stimulated by different frequencies. So high frequencies, low frequencies can impact how you hear certain things. It carries vibrations that are converted to electric impulses, and then those impulses are carried to the vestibular cochlear nerve, which is then moved to the brain. So you have the outer ear, you got the middle, and then the inner ear, that's where the cochlea is. And so noise will travel in through the ear and through to the cochlea. And then, like I said, those spirals, depending on the level of noise, depends on like how much you hear, how loud it is, those sorts of thing, and the vibrations. Very interesting. So how does it work? So sound waves are collected by the outer ear and are funneled through the ear canal to the eardrum, where sound waves cause the eardrum to vibrate. The three bones of the middle ear transmit and amplify the vibrations to the oval window of the inner ear, where fluid in the inner ear stimulates the nerve endings called hair cells. And then that travels through the cochlea and through all of that to the electrical impulses, which are sent from the hair cells along the auditory nerve to the brain. So from that outer ear, through those vibrations, through the cochlea, and out to the brain. So there's a difference between deafness and hearing loss. So deafness mostly refers to individuals with profound hearing loss, which implies very little or no hearing ability. This is often those individuals who would use sign language for communication, and deaf is embraced as a part of an individual's identity. So you may hear that somebody wants to or identifies as somebody who is deaf. And so that there is a very strong deaf community, and they appreciate being identified by their disability in some cases. And then hearing loss is where an individual has loss of hearing ranging from mild to severe. These individuals are usually referred to as hard of hearing. They communicate through spoken language, but may benefit from things like having a hearing aid, cochlear implants, closed captioning, and other assistive devices. So the prevalence of some degree of hearing loss, 1.5 billion individuals, 430 million people over 5% of the world's population require rehabilitation regarding their disabling hearing loss. And the World Health Organization estimates that 700 million people, or 1 in 10, have some form of a disabling hearing loss by the year 2050. So not too far away. Projections predict that nearly 2.5 billion people will have some degree of hearing loss by 2050. About 80% will have disabling hearing loss and live in low or middle income countries. And the prevalence of hearing loss increases with age. So over the age of 60, over 25% are affected by disabling hearing loss. So just kind of showing you what the prevalence looks like. Diagnosis, physical exams can be used, looking at screening tools. So having them do a hearing test can be used. Tuning fork tests and odometer tests can also be used. We as recreational therapists would not be diagnosing somebody with hearing loss, but we would need to understand what that means. And so this is something you may be able to provide to your client to determine if they have hearing loss and maybe need to have their hearing tested. And so again, you can take a screenshot of this. I just think it's kind of interesting to look at. Prognosis, it depends on age, cause of loss, and number of factors. But depending on the individual, it usually is permanent and can get worse over time. There are different treatment options that are available. One thing that they can try, at least at first, is removing earwax blockages. And so that can help with hearing and being able to hear what may have been more difficult to hear before the earwax was removed. Surgical procedures can also be done, things like adding a cochlear implant or using surgery to help in clearing out the ear can be done. Also, hearing aids and cochlear implants. There are different systems that are affected. So if we're looking at the primary system, which would be auditory, it would affect the inner, middle, outer ear, or acoustic nerve. But secondary effects, tinnitus is very common, which is the ringing in the ears. So if you've ever gone to a concert and maybe sat really close to speakers, you might have had that ringing in your ears for a little while afterwards. That's the tinnitus. But for somebody who has this in this form, it doesn't go away, and it's not just caused by going to a loud concert. Meniere's disease also affects roughly 615,000 people in the United States. We'll talk about that in a minute. And then there's also Usher syndrome, which affects approximately 4 to 17 per 100,000 people, and accounts for 3 to 6% of children who have what is known as hard of hearing. There is also the specific causes based off the lifespan. So prenatal period, there may be genetic factors that are either hereditary or non-hereditary. There's also intrauterine infections, which may cause things such as rubella and cytomegalovirus infections, which can also affect hearing. During the perinatal period, there may be birth aphasia, which is lack of oxygen at the time of birth, which can potentially lead to hearing loss. Hyperbilirubin, which is jaundice, basically. Low birth weight and other prenatal comorbidities can all lead to potential hearing loss. Hearing loss in babies is a little bit different than it may be, it's a little bit more difficult to test. And so this can show you, if you are a recreational therapist working with babies, kind of what to look for at different parts of their lifespan. Within childhood and adolescence, chronic ear infections can potentially lead to hearing loss. Collection of fluid in the ears can also, and then meningitis and other infections that may affect, because meningitis affects the brain, it may also affect that part of the brain. Adulthood and older age, things like chronic diseases, so things maybe diabetes, kidney disease, or heart disease can lead to hearing loss. Smoking, osteosclerosis, age-related sensorineural degeneration, and sudden sensory neural hearing loss. So all of those can be potential factors as well. Factors across the lifespan, again, different things that can affect them: loud noises, loud sounds. Having loud music in the car can potentially lead to hearing loss. Work-related conditions and things that might happen on the work site, viral infections and other ear conditions, and potentially delayed onset or progressive genetic hearing loss. Occupational hearing loss, like I said, is common. So these are the top working professions that may be linked with hearing loss. So factory workers, entertainment venue employees, musicians, farmers, dental workers, which was kind of surprising, but like the drilling and those sorts of things, construction workers, coaches and game officials, due to the loud volume in arenas, elementary school teachers and cafeteria workers, surgeons, and military personnel. So just interesting little fun fact for you all for today. Okay, thinking about prevention. So there are effective strategies for reducing hearing loss at different stages of the life. So things like immunizations, good maternal and childcare practices, genetic counseling to determine, what may be the cause of certain conditions, identification and management of common ear conditions like ear infections, occupational hearing conservation programs for noise and chemical exposure. So things like listening to music at lower volumes can be really helpful, or wearing earplugs when going to loud concerts. Using medicines to prevent hearing loss, and personal hearing protection. So just things to consider or to share with your clients. There are different types of hearing loss. So there's conductive hearing loss, which is caused by something that stops sound from getting through the outer or middle ear. It usually can be treated with medicines or surgery. So just kind of depends on what it is as to what is blocking the sound from going through the ear. There's also sensorineural hearing loss, which is hearing loss that occurs when there is a problem in the way of the inner ear or hearing nerve works. And so something is happening in that inner ear that is causing difficulty with sound. There's also mixed hearing loss, where it could be a kind of a mixture of both, usually caused by genetic disorders, infections, or head trauma. And then lastly is auditory neuropathy spectrum disorder, which is where hearing loss that occurs when sound enters the ear normally, but because of damage to the inner ear or the hearing nerve, sound isn't organized in a way that the brain can understand. So the ear gathers sound from the environment and changes them into messages the brain can understand, but sometimes these messages are jumbled. Other times the sounds don't reach the brain. So when this happens, it's called that auditory neuropathy spectrum disorder. Kids who have this disorder may have trouble telling one sound from another, may not understand speech clearly, may hear sounds that fade in and out, or seem as though their hearing changes. So just again, depends on what it is, but it's that difficulty with understanding the message. It gets a little bit jumbled. There are different degrees of hearing loss. So middle, moderate, severe, profound. So middle hears some speech sounds, but soft sounds are harder to hear. Moderate may hear almost no speech sounds when someone speaks at a normal level, so they need it to be louder. Severe hears no speech sounds when someone speaks at a normal level, but may only hear some loud noises. Profound will only hear any speech and will not hear any speech and only very loud sounds. So like fireworks, for example, they could hear. There also is differences in the types of hearing loss. So it could be unilateral, so that's on one side of the brain. bilateral on both sides, not of the brain, of the one ear or both ears. So unilateral, one ear, bilateral, two ears. Could be prelingual, which is where the loss happens before the person learned to talk, or postlingual, after the person learned to talk. Can also be symmetrical, where the hearing loss is in both ears, or asymmetrical, where it's different in each ear. It can also be progressive, where it worsens over time, or sudden, where it happens rapid onset. There's also fluctuating, where hearing loss over time gets better or worse, and stable, where it stays the same. So it doesn't get any better or worse, it just stays kind of at that level. There's also congenital acquired or delayed onset. So hearing loss that presents at birth would be congenital, or it can appear later in life, which would be acquired or delayed onset. As a recreational therapist, we can work on community integration, health promotion, functional skills, thinking about helping them with certain things that they may need more assistance with, and being as independent as possible, helping in developing their leisure skills and coping mechanisms, and then also helping with communication awareness and reintegration. There's different modalities, so auditory oral, which is acquired competence in spoken language, both receptively and expressively. There's also total communication, which involves one or several models of communication. So it could need to be written, signed, spoken, or manual. You can also use sign language, and then signed exact English, which is a system of sign language, which follows word for word English. So instead of using a sign that could mean multiple words, with sign exact English, it's using each sign means one word. So each thing you're saying would be its own word, its own sign. Assistive listening devices can also be used to help in amplifying the sound. So helping to make things that may be quieter, louder, and easier to hear. Also can be used with hearing aid, not air, or a cochlear implant to help them with being able to hear sounds better. A hearing loop can be used to transmit sound, an FM system, which is using radios to transmit sound. Infrared systems can be used to convert sounds into light and then send it to the receiver. And then also personal amplifiers. So you can kind of see some of those here, different devices depending on what it is that you are trying to use the system for, but things that can amplify the sound to make it easier for somebody to hear. There's also augmentative and alternative communication. So this is devices that help individuals with conditions regarding communication to express themselves. So they may use these devices, for example, you can see the one there, to be able to say what they want to do or what they want to eat or how they're going to do certain things. So it may be like a tablet like this one, or it may be something where you speak and record you saying different things, and they click on the button of what they want to do, and then it auditory says what it is. So you can hear it as the person who has hearing, and then the person who has a visual or a hearing impairment would be able to click on the button. Alternating devices. So they do have products that can help with things like if a baby's crying and they have the monitor, it can flash lights at them. Or for example, if like a doorbell goes off, an alarm clock, fire alarm, smoke alarms, different ways for them to be able to know that the alarm is sounding. There's also a video here. It's a video. Let me double check. Yes. So there's also a video here on what a cochlear implant is. So I'll show you that in just a second. It kind of just explains what that looks like, so it can help you in understanding it.